Good morning. It was a pleasure to be here. Thank you, George, Cijo, and Ramses for inviting me, bringing me to beautiful Geneva. As Cijo said, we can keep our life a little easier, and I certainly do, but I don't really look for much of a change. I try to stay same as I've been doing for the last almost 20 years at Columbia University, teaching microvascular surgery to many surgeons. It's just we have to go a little bit deeper and stay in the same, just improve the quality by repetition. So I'm going to tell you a little bit about how we do it here and what I teach in Columbia, New York. Well, go for any training, as you know, as of course learn something new. It's like we're learning something new every day. And now here in the robotic surgery meeting, we learn about what's new in robotic surgery world. Get better on something you already know and you achieve. Practice something new or familiar technique to just become better, proficient, and more efficient in time. By practicing or training, you can achieve confidence in your work, which is very important for every surgeon. And in a lab, which I run, you can use easily trial and error methods in a control environment, not an operating room and everybody nervous about quality of a patient care. In a lab, you can actually do mistakes and try what is it you've done wrong and what do you do to avoid them in the real world. So training at Columbia and Department of Orthopedics, I was pretty lucky to work there because department really appreciate the skills that we give in our residents, even not very many of them becoming microsurgeons. Actually, very few of them becoming hand surgeons, but we mandate that and we make them all to take the courses twice actually during the residency. They take basic micro at PGY3 when they're 3rd years of training, and PGY5 when they have a hand rotation. So they do advanced course. And even though they suffer a lot, they actually like it. We teach about 200 surgeons from 12 specialties, not only orthopedics, hand surgery, neurosurgery, ENT, maxillofacial, a lot of others. And from about 50 programs in US and about 50 countries coming to take the courses. So you can see I just took a few pictures, and I like this one is I think they're Norwegians. They're like 6'2", 6'7", and I'm 5'2". So that was a funny picture. I'm on a step stool and still cannot reach. But I'm saying, you know, people are coming from all over the world. And it's interesting, they're all different, and it's fun to teach them to become pretty efficient, just short 5 days. Anyway, so goals of my training and my actually motto in life, and I've been talking about this for many years in many different meetings. I think people who take the courses like this, especially microsurgery courses, even if they're not becoming a microsurgeons, they're becoming better surgeons at whatever they do. And I think you will agree on that, because it's pretty tough and it's really difficult. But after completion of the course, they're becoming much better specialty technical surgeons at whatever specialty they are. We teach them how to gentle handling and dissecting little fragile vascular nerve tissue, which is important. And of course, they're learning how to proficiently perform microanastomosis, which is 1 millimeter diameter. I'm telling you, sometimes sport surgeons who are our residents, and most of them are sport, or joint, and you know how they're hammering and drilling. To do a little structure like that, they go back to operating room, they meeting me in a hallway, said, oh my God, we're completely different. Now I appreciate what I actually dissecting and working around. That brings me to the point that taking the microsurgery course are useful to all kinds of surgeons. And again, gentleness and handling, and I think it's #1 for every surgeon. Attention to small details during surgery is important. For robotic, or for general, or for hand, or for anything, it's very important. Since we're working with instrument, it's very important to coordinate with our eyes and hands and sometimes foot. So that's important for robotic surgeon and for regular surgeon, and especially micro. While you're working, you have to learn how to problem solving very quickly. And decision-making skills is very important in microscopic for every surgeon, not only microscopic surgeon, and everyone. So that's important. And you know, during the course, I can see sometimes the people start depending on instructors. So I have students sometimes asking me every 5 questions, Elena, what do I do next? Elena, what do I do next? In the beginning of the course, that's fine, and later on I'll ask them back, what do you think? What would you do? Because I'm not going to them to Australia or Germany or Taiwan. I need them to make decisions on their own. So I know when they are operating on their own, they don't depend on an instructor or attending or whoever is there holding their hands. They will learn to make their own choices, and I think it's very important. So again, during these 5 days, they're not only learning how to put vessels and nerves together. They're learning a lot of different things. Sometimes they don't even appreciate how much they're learning. Self-control and patience. I know you're all surgeons. I know this is not your big strength. And none of you are patient. And it's hard not to be, because in micro, especially in the lab, especially learning, it's almost impossible when you're losing it. And I had people who had to go and take a break and control themselves, because it's frustrating. And it's okay. I call it healthy frustration. They are learning through the frustration. They understand how difficult and humble this procedure are. And well, hopefully they're becoming better and better. And then they're learning patience. And I have a guest book that everybody write the notes to me when I'm done, and they all say, thank you for your patience. And I think sometimes I thank them for their patience as well. Mistakes. It is hard. And again, you're all surgeons. You know, recognizing mistakes is very important during your work. And whatever you do, robotic or open surgery, any kind of surgery, you have to recognize what you've done wrong. And what is it why you're doing this, and how to fix it and not do this again. So during these courses, the people learn to do that with my help, because I evaluate everything they do, and we talk about how to fix it, which is very important. Again, they're not going to operate on rats all the time. They're going back home and operate on humans. So I really would like them to know what can they do wrong and what to do to fix it. Now, we all train to do fast, because it's normal for surgeons to do as fast as they can. In a laboratory, during the courses like this, quality of techniques, I put ahead of timing. So I always tell my students, don't rush. Don't go and speed up. Go slowly, become good, and then you'll become fast. Confidence and speed will come with comfort. When you're tying faster, when you're picking up the needle quicker, your speed of the surgery will improve. But so I have a lot of surgeons who fast, they go too quickly, and they do a lot of mistakes. And they really suffering until I stop them. When they stop and they go slowly, they become much more better. This is my lab. And I think it's a completely stressful environment, but because it's only small classes and it's a kind of a friendly environment, we all talk about it, and it's not that stress when you have a lot of people and you have to keep up with the group. It's kind of easier way of learning. I have an instructor who is me, and it's only 3 people, so I really do one-on-one, and I evaluate and critique everything that they do. We practice, again, surgical thinking. I make them to think I make them to plan the surgery. I give them the heads up, but they are sometimes asking me questions that I would hope they would not ask if they think a little bit. And hand dexterity, of course, we start doing some non-animate object, and they're learning how to operate with the small motions of the heads, or the hands, I'm sorry. Open mindset, it's very important. In microsurgery, robotic or not, open mindset, it's very important. It's something new. What Sidra was saying, something always new. You have to open your mind, especially if you're learning different things. And I have this little talk on Monday with every student. I have courses Monday to Friday. So every Monday I have a new group. So I give them a little speech every Monday. So how difficult it is. So they some of them have no idea. They've never done microsurgery before. So I have to explain to them. They're not listening sometimes. They kind of listen, but they're not hearing, so they understand. But as soon as they sit down under the microscope, they know what they were talking about. It's frustrating. Overconfidence can hurt. So people, and sometimes I kind of let them do that. So, you know, when you ask questions, they said, yeah, I know. And I said, okay, great, if you know, let's see what you know. And in 10 minutes, 15 minutes, they know that they actually don't know. So they have to learn something. As everybody has different learning curve. If you have a group, especially a group of surgeons, you really have to explain to them that the competition in the labs like that are not as great. So don't compete. Everybody has their own learning curve. Everybody learning differently. Some go faster, some slower. So because I have monitors in the lab and they're all looking what they're doing, and sometimes they get upset when somebody going faster than the others. Asking questions, follow directions, and every surgeon know how not easy it's to do, but in the lab it's important. So classes are small, which allows us to pay individual attention to people, show little tips and tricks to everybody. Again, kind of perceive the learning curve for everyone, allow time for mistakes and how to fix them, and recognize them, which is important. And I actually observe the students remotely. If you can see, we have monitors for all 3 scopes. So sometimes I don't sit with them. I just stand in the middle of a room and give them a little instructions. So they won't even, it's less stressful when you sit down on the other side of the scope and people start having Helena syndrome. They start shaking very much and just get nervous. When you're in the middle of a room and you just say, you know, bring the microscope in, bring the clamps together, irrigate the field, it gives them a little tips, but it's not making them very nervous. I do encourage them to ask questions, as many as they can. And sometimes it's not that easy, but it is actually needed to do while they're learning something different. Now, this is the course. This is just a quick curriculum that we teach. It's 40 hours. It's 5 days, Monday through Friday, pretty much all day long. We start working on a small plastic glove just to get them know how to work a scope and tie nuts under microscope. Then we do end-to-end anastomosis, 3 different arterial techniques, vein, interpositional vein graft, different end to sides, and peripheral nerve. So this is 5-day course. It doesn't seem much, but it's pretty intense. And what we do not move until something working. So we cannot move to next exercise until the exercise working. So the anastomosis has to be patent to move to the next one. And it's because it's, again, small class, it allows us to do that. We also do more advanced microsurgery for people who've done basic, and we do more end to side, different free tissue flaps, carotid work, neurografts, and more specialty tailored for the people from different specialties. I teach sometimes people who do transplants and all kind of different techniques. This is all done on rats. Now, microsurgery moving, as everything else in technology and in the medicine, we now a lot of talk about the lymphatic surgery, which is very precise and very small and very difficult, technically difficult. So we developed a small course that is very challenging, and it's more for advanced surgeons, and we call this Supermicro Surgery, and we teach very small vessels from 0.3 to 0.8 millimeter diameter. Of course, only advanced surgeons can do that. It's the same 5-day course. It's much steeper learning curve. It's much difficult, requires a lot of repetition, and we use living and non-living models. So, and again, Supermicro Surgery, because we are moving towards the smaller and smaller stuff, vessels, and a lot of done about lymphatic work now. So I work with Dr. Chen from University of Iowa, and I adapted his chicken model, which is pretty good, very cheap. And you can see if you dissect further to this little tiny vessels, they keep becoming smaller and smaller and smaller until you can get it so 0.25. Even dissecting this thing will requires a lot of skills. So it's pretty cool. And then we'll do rat, and we're using 11.0, and we're isolating epigastric work. So basically it repeats the basic on the smaller scale. So we do 0.3 to 0.5 millimeter vessels on, again, end-to-end, end-to-side, grafting, using the smaller vessels on the rat. To achieve the patency, which is really tough, we can put like 7 nylon as a stent to see if they're still inside and we didn't penetrate the back wall. And I'm using transonic blood flow measurement to actually pick up the flow. Well, it's new. It's really just starting up, and more people taking it, and it's developing technique that allows people to do more precise and more specific and small surgical procedure in OR. It's really improved surgical skills, microsurgical skills, and we hope to develop a new generation on Supermicro Surgery. They can take on lymphatic surgery, and hopefully it will work. It's a lot of problems for people in the operating room. Evaluation of the quality, it's important, and it's getting more and more important in a world that we can actually assess the skills that our people are learning from us. And it is important part in microsurgery as well. It should be taught to every student, and they should be comfortably and reliably evaluate their own work. And it can serve as a predictability tool for the patency for the future to prevent and decrease the failed anastomosis. So by now, what I do and pretty much everybody do, we evaluate it visually. So we actually look at every anastomosis and see how we're done. So we can actually open it up and look at the lumen and see if the lumen is patent. And subjective practice tests, patency, timing, quality of anastomosis, everybody do anyway. So this is working so far, but it's good and it's subjective. But every student should, if you don't have anything else, they should be able to evaluate the work and assess it pretty comfortably and correctly. And the OR now have a lot of tools that you can use to evaluate that more objectively and get a certificate that's actually good to have, and people have feeling accomplishments. So I'm just going to briefly talk about this. There are a lot of other methods. I'm just going to mention the global rating scores and hand motion analysis that they've done for many years by now. It's a great tools. It's just very time consuming, and it's I wish it could be a little bit more less cumbersome, but this is the great assessment tools, and it's been using for many people in a lot of courses. So we use also transonic Euroflow as a method of quality assessment, and it's pretty quick, it's objective, it's reliable, and we've been working with this for quite some time. So I'm trying to work with my students, and we try to make like a table, predictability table for the surgeons, because they developed now a small 0.7 millimeter probe that can evaluate the quality of anastomosis made from 0.5 to 4 millimeter diameters. It just works pretty much as it is similar to Doppler. It just measures the blood volume, not the velocity. So that's what our work so far, and we're trying to test sensitivity and specificity, and get the cutoff points of immediate post-op blood flow. So basically we're measuring flow before and after anastomosis and 24 hours after. So if you want to have 100% sensitivity of your vessel, your post-operative flow should, on 1 millimeter diameter vessel, should be about 0.3 milliliter per minute. If it's less than that, you have a less and less sensitivity of that patency in 24 hours. So this is the same thing, just with a graft. So I just gonna say a couple words. We are working. Yeah, it's internet. We developed a small society of called RAMSES. It's supposed to be international. The top International Microsurgical Simulation Society, and Sicho and Jesse was part of that, and Philip, and we tried to work with RAMSES together because we're pretty much doing the same thing. It's a network of people who does what I do. We teach and we promote microsurgical education all around the world. And we started in 2012 in London with a couple of people, like RAMSES started with a few people. So now we're growing and growing. It's not that, still it's not that big, and we don't want to be big, but it's very enthusiastic society of people like RAMSES. Very similar idea. So people who teach and want to become better and want to promote surgical, microsurgical education as a part of the surgical education in the world to become, the quality of the surgical education should become bigger. And the next meeting, you all invited, of course, will be in Italia in April. So we're gonna go to Turkey twice next year. Yeah, we're joining the European Federation for Society of Microsurgery. And it's a pretty enthusiastic group, and I'm really happy to be part of that. And I'd like to thank you for your interest and support. Thank you.